Yes, welcome. Good evening. Nice evening that we do our random question and answers. Random questions and answers where you are and every place that you are chilling at. I think you're feeling good and nice. You're feeling good and nice. In the evening, I just answer questions that are random. Questions that are random. Questions that are random and some questions that come from our followers, you see. But at 4, we usually do some topics. But today we said this week we will be talking about topics of what people have suggested. So that is it. That is it. We are continuing slowly and better. So if you are coming in as a new guy or a person, this is Benjamin. The channel is called Benjamin the Wise Guy. Benjamin the Wise Guy. We talk about medical issues in this channel, so you can chat and say where you are watching from. There we connect. Yeah? You subscribe, we connect. If you have any medical question, we talk and then we continue. So this time of the evening we usually do question and answer. Question and answer is where you ask any medical question and we talk about that thing that you are answering. So if you are new to the channel, please be free to subscribe. Don't just watch and push over. Sometimes people watch and push over, and maybe there will be an important thing that can help you as we talk. So guys, subscribe to this channel. Down the subscription. Let the channel grow with your subscription. And if you have any medical issue that you would like me to tell you or answer you, you can ask me anything. But today we were talking about glands of the body. We talked about some glands like the thyroid glands. We talked about some the ovaries, pituitary glands, what they do. Some people asked for some questions that they asked and they got their help. So you watching me, if you are new, please let me get to know you at the chat. Text at the chat, ask me what I do, why I'm here. I would like to know more new people. If you are a new person, I would like to know you more. So don't hesitate to interact with me. The chat is open. You can text there and ask me. Hi, let's associate as we ask each and everyone a question that can matter in a matter of health. And it's good sometimes to talk about matters health, because health is everything. Wherever you are walking, whatever you are eating, whatever you are thinking, whatever you are doing, health is important. So even mental health is important. I keep on saying that mental health is the key responsibility you should handle for your body to be stable. Mental health is the key responsibility you should handle for your physical health. You get, for your physical health, because everything starts from your mental health to the physical. Everything we talk about here is about mental health. So let me get to know who is watching. I can see some people are watching and they are not asking anything. So if you are there watching, welcome to the channel. I'm just logged in right now. I've just logged in right now. Let me see where you are. Let's talk. Chat, text me there, ask me what I'm doing to this channel. Some medical issues and random talks. Let's talk about some random talks like what is the thyroid gland? What does the thyroid gland do? Factors affecting mental health. Factors affecting mental health are diverse. Factors affecting mental health are many. It may be stress, normal things. It may be physical. It may be some things that people are struggling with, and let's talk about them. So if you are watching, welcome to the channel. You are obliged to see you here. Hit the like button and let me see where you are coming from. Tell me where you are watching from, and let's interact as we talk. Talking is good. Sometimes in the evening when you discuss issues with friends and you feel better and some stresses go down. So my friends, where you are, check if you have subscribed to my channel, to this channel, and let's get to talk now. We have talked about the thyroid. Someone asked about the thyroid and its effects to the body. The thyroid and its effects to the body. So there was a question that was asked. Someone asked a question: what is hyperthyroidism? Hyperthyroidism is it starts from your brain, where it comes to when you have low thyroid hormones. There is the thyroid stimulating hormone, which stimulates to produce thyroid hormones, T4. So when it stimulates to produce T4, which is thyroxine, thyroxine is converted to T3. And when your thyroid gland does it so much and is stimulated and it brings more thyroid to your body, that is where we call hyperthyroid. Hyper is high, and the work of thyroid, that is a lot. The T3 that is active, it enhances something that is metabolism, breakdowns of glucose and energy, and your body works so faster. You understand? So hyperthyroidism leads to a person to be thin. And sometimes when you are, when your body is breaking down things so faster, and making your body to be active, you create more heat. So if you are exposed to a certain to heat again, even the sunlight, you feel that it is burning. You feel like, hey, this sunlight is burning. So when you have high thyroid hormone in your body, hyper T3, you have heat intolerance and you become thin. Your eyes are like this, popped up, because you have hyperthyroidism. But there are some instances whereby you have a problem with production of thyroid stimulating hormone, the hormone that stimulates the thyroid gland, or you have a problem also with the thyroid gland itself. So this one makes you to have low thyroid hormone. You need a supplement like levothyroxine. You need a supplement. A supplement is to enhance your thyroid. There you will have a big body, opposite to the other one, which will have a thin body. So a big body And here you will have something that is called cold intolerance. You are always having cold because your metabolism is low. Your body is not producing enough heat. Your body is not producing enough heat. You see? So these are the factors that we look at, and then we see the difference between thyroid, hyperthyroid, and hypothyroid, high thyroid and low thyroid. Those are the differences that we look and see that. Now, there are some things in life. We talked about glands. So these glands, as they are working on you, if you get a problem, how to treat these problems. When it comes to glands that produces hormones, there is no shortcut. You have to replace or treat the condition that is bringing that problem. You know, some people say that there are some conditions you cannot treat. Like if you have something called thyroiditis, you will not treat it. You have to supplement. You have to supplement with the same hormone. We have seen adrenal glands like in the kidney that produces adrenaline, produces adrenal cortisol hormone. See, those are hormones that are like adrenaline is for fight and flight. It helps you when it comes to some issues. So if your kidney is suffering, you will have some problems. Like this cortisol is a steroid. You will have some problems. Some people, when they like cortisol, they have a low. Kidney issues are very complicated because if you have a kidney problem, the first thing you will start having is pitting edema, that is swelling of your foot. And then after you have swelling of your foot, your pressure will go down. After your blood pressure will go down, you will have hypotension. Your heart will start to compensate. That one leads to heart failure. Now we are not just at heart failure. We check. We go to another step whereby when the kidney is suffering, you know, the kidney helps to produce a hormone that is called erythropoietin. Erythropoietin is a hormone that helps you to get enough red blood cells. So imagine you have acute kidney injury, and then it comes to be chronic, because kidney injury, when we talk about kidney injury, acute or chronic, it means if it is acute kidney injury, what do you have? The kidney has failed to filter the blood and remove toxins as needed. So if you take something like excessive alcohol or some drugs, and then it goes to the kidney and brings a problem, that one we call acute, because you have been healthy, and all of a sudden you have taken something that your kidney has been injured. So what do we call it? Acute. But if it becomes chronic, whereby continuously the kidney is not filtering blood, until sometimes people go to get dialysis. Dialysis is an option of a kidney that is failing. Instead of you getting a lot of toxins, we get you to a machine, it filters your blood. That one is called chronic kidney injury. Patients that have chronic kidney injury, most of them, you will find their pressures are high, very high. Why? Because one thing, the kidney produces something called renin. And renin enhances something that is called angiotensinogen. So when it enhances angiotensinogen in the blood, that is something that is in the blood. The angiotensinogen is converted to angiotensin 1. So there is another one called, no, from angiotensinogen to angiotensinogen 1. So when you have kidney injury, renin is released. When it is released, angiotensinogen is converted. Renin enhances angiotensinogen to convert to angiotensinogen 1. So angiotensinogen 1, that is Fatma Yid, wish to reach God. Oh, you wish to reach God. Okay. K. Oh, that one. I can't read that Hindi word. So if you are watching and you have texted, welcome to the platform Fatma. Welcome to the platform the other one who is reading by and Hindi. So subscribe, my friends. If you have medical issue, please ask. If you have any medical issue, you ask me so that we talk. So after angiotensinogen 1, there is an enzyme that converts angiotensinogen 1 to 2, which is a vasoconstrictor. So it makes your vessels constrict and your blood pressure to go up. That is not even enough. If you have kidney injury, it will stop producing enough erythropoietin. Erythropoietin is a hormone that helps you to produce enough red blood cells. So if the kidney does not produce, you have anemia. Just imagine, guys, if you are watching for the first time, please hit the like button, subscribe, and tell me where you are watching from. Fatma Yildir, where are you from? I can see you have texted. Which side are you from? My guys, those that have texted, tell me where you are watching from. Let's connect at the chat. Tell me where you are offering from, and if you have any medical issue that you want us to talk about, tell me, we discuss or I help think about it. Now that is kidney injury. You see, so the adrenal glands are injured too, and then that's why you will find most patients that have diabetes, some of them ends up to have problems with the kidney, because high sugar levels, what do? They attract bacteria, and you get these people, women or men, continuously having urinary tract infection, that it may go up to the bladder to become cystitis. So the bladder is the one that collects urine. After the bladder, it can go up to the kidneys, and then they lodge there. Bacteria starts to form their colonies. And if bacteria are forming colonies there, what is happening? You start getting glomerulonephritis, nephritic syndromes, and then your kidney starts to have problems. You start having acute kidney injuries. You see, so it's very important to learn these things. And people that are diabetic, and if you are given medicine, people that are diabetic, and if you are given medicine, please follow the medicine as per the doctor. It's very important, because one thing leads up to another. I can see person has liked. If you are watching and you are feeling revived, like and subscribe. You know, one thing can lead up to another. Patients that have heart diseases, heart failure, it started from somewhere, like you have a sore throat. You know, I'm talking random questions, talks. I'm having random talks. If you have a question, let's interact at the chat. Tell me where you are from. Let's interact if you have any question. So, you know, imagine this. You get a sore throat of Streptococcus pyogenes. It gives you a Streptococcus aureus, units, and those are bacteria. So you get a sore throat, and then the bacteria goes to the bloodstream. You treat yourself partially, and the body immunity manages to clear the bacteria by itself. But you know, Streptococcus pyogenes leaves a toxin which is called streptomycin in your body, or some colonies of bacteria. So they go and they launch into greetings, FRC. FRC, welcome to the channel. I'm just having a random talk, things that are connected. I can see someone said hi in Hindi, and I cannot translate it even in the screen. I cannot translate it even into the screen. Let me see if I can translate this. Hide root user. That one is hard, unless if someone translates it to me. I don't know what this guy is called. So I was talking about random things. Now you've got a sore throat, and it has left a toxin to your body. That toxin is called streptomycin. And there are some colonies that go to your heart. So, it's called Hamzal Mohammed. Hamzal Mohammed, you said hi. Thanks a lot for saying hi. So when it leads the toxin in your body, something starts to happen. The toxin goes on and it starts to destroy your heart muscles, destroying your valve muscles of the heart. The bacteria come on and they continue. So that one leads to heart failure. Inefficiency of blood circulating to your heart brings low perfusion to your brain. You start being confused. Your brain starts to die early. You get something that is called brain atrophy. Your brain becomes smaller faster because of the brain cells have. Because of chronic hypoxia. Hypoxia is lack of oxygen. You see? So these are things that are connected, that sometimes it's good when you see some danger signs. It is not good to ignore, your feet. You see your feet have swollen. Don't ignore once or twice. And then you say that I'm always okay. When I've traveled, my feet always swell, but when I relax, they go back to normal. You see, these are things that we should get in touch and connect and talk about them. There are some things like thyroid. The thyroid. What do you feel? The danger sign. Chat Travels, welcome. I know today you are so busy at work, like me during the weekend. There are some things that the thyroid can be exposed to. Chat Travels, thanks for being here. FRC, thanks, and I can see some others that are not saying hello. Just say hello and let us know where you are watching from. Let us know where you are watching from. And it's good we interact. If you have any medical question, you ask, we connect. Now, we have some problems that can appear to someone. It's a random talk. So if you are a new person, don't be surprised how I'm picking my calls and my talks here and there. It's just a random talk. Chat Travel says she's watching from Florida, you see, and I will just listen and be in the background. Yes, no problem, Chat Travel. It is it's working hours, and me, I'm supposed to finish and go and relax. Here it is at night. Here it's at night. It's 9:41 p.m. So let's talk about things that can destroy your thyroid. There are so many things that can destroy your thyroid, so you start having thyroid problems without knowing. Autoimmune distractions. Most common Hashimoto thyroiditis. That is what I was trying to tell. And the immune system attacks its own cells of the thyroid, thinking that these are strange things in the body, and they are your body cells. You see. Hello, coffee cakes. Welcome. Today, I kind of like missed you, but I hope you found my text on your WhatsApp today. Yeah? I texted you, not WhatsApp, on your Instagram. Yes, I texted you on Instagram. Now, autoimmune diseases can destroy your thyroid. You see, surgery can destroy your removal of part of the thyroid gland. Surgery, it can destroy your thyroid gland. At times, it is not good to expose your body into surgeries. It is not good to really expose your body to surgeries. Radioactive iodine treatment, used to treat hypothyroidism or thyroid cancer, destroyed it also. When you are exposed to the radioactive iodine, for those people that have hypothyroidism, when you are exposed to it, what it happens, it destroys your gland. So it destroys the tissues, your gland, and that is not good. It is bad. It is called radioactive iodine treatment. It helps you in another way, but it brings the destruction of the thyroid gland. Thanks for those who are tuning in. The Coffee Cakes, Loving Beach, FRC, Share Travels, all of you that are here, FRC, all of you, thanks so much for tuning in and listening. If you have any random question, at night we either talk randomly and or ask questions, or I go to the email and see some chats that are there that have been asked. So let's talk about inflammation. Inflammation can be viral, autoimmune, or bacterial that you have in the body, and it is eating up the thyroid. Those are things that can destroy your thyroid. You see, radiation exposure, those people that work in companies, and those companies that have high toxic levels of radiation, can make you have thyroid toxicosis. Drugs. There are drugs that can destroy your thyroid. We talked about the people that are bipolar and they are taking lithium. Lithium can destroy your thyroid gland itself. So you may start producing less of the hormone T3, T4 that is converted into the blood to T3. So people that have bipolar, I see the Coffee Cakes is listening keenly and kind. So if you are listening to me, be like the Coffee Cakes. Ask a question, write down some notes. They are important. They are very important. Amiodarone for people that have heart diseases. If you are using amiodarone and you have heart disease, you should be checking with your doctor every time. Because it may destroy your cells and your thyroid will start having problems. We have talked about infections and trauma. You see, so the things that can destroy your gland, the thyroid gland, are like autoimmune destruction, surgery, radioactive treatment, radiation exposure, drugs like lithium and amiodarone. For lithium, mostly is used as a mood stabilizer for people that are having ADHD and also bipolar. And then we have amiodarone for people that have heart diseases. It may destroy your thyroid. Let's talk about infections and trauma. Infections can be something that can destroy. David Njoroge. David, hi. How is you doing? David, which side are you watching me from? Thanks, David. David, thanks a lot for the like. Let's ask any question that you have. So, rare causes of the thyroid gland. See, infections are rare causes because the thyroid knows how to protect itself. Trauma. Maybe you have an accident, but those ones are rare. Now, what can be the effects of thyroid distractions? Today I'm just having a random talk, my friends. If you have a question or you want us to talk about something, ask us. Come to the chat. Tell us, I'm feeling I want to know about this. Who knows it better, or can you explain how I can get help on this? If you are a new person, hit the like button and subscribe. Subscribe it. This random talks may help you. One day you can answer yourself. I'm watching from Lodwar, but kindly, my friend, I'm a GSU officer. Yes, David. Thanks a lot from Lodwar, and I respect you guys, protecting the places, and we respect you. So thyroid masses with the blood, yes, higher or hyperglycemia. Or hyperglycemia is about glycemia is about glucose, glycemic, that is glucose. So thyroid masses with the blood, yes, hypo or high sugar. Now it depends. You have a problem maybe with insulin resistance, the coffee cake, and then you have hyper, you will have hypo. If you have more thyroid hormone, the result will be the reverse. You may have hypo. But if you have hyper thyroid glands, high thyroid glands, the result will be hyper. If you have high thyroid glands hormone T3, the results will be hypo. So the opposite, yes, I know two people on diabetes, one on hypothyroidism. Yes, you see, it relates. If you have hypothyroidism, you will have diabetes. If you have hypothyroid, it is the reverse. If you have hypo, because this is it, when you have hypothyroidism, both taking thyroid meds. Oh yeah, if you have the big body, you are tended to have, hypothyroidism. People I have a lot of injury. I have broken my legs and arms. I'm very hyper by nature. Are you okay to keep working? Okay, let me answer the question of the coffee cakes, then I answer you, David Njoroge. Hypothyroidism leads to diabetes because you have a big body and you get insulin resistance. Big body, insulin resistance. See, insulin resistance leads to diabetes. That's why people with hypo leads to insulin resistance. But hyper means your T3 is working. Yes, that is diabetes type 2. Type 1 is the one that you are born with. So David Njoroge says, I have a lot injuries. I have broken both my arms and my legs, but I'm very hyper by nature. Am I okay to keep working? Now, David Njoroge, this is what I may say. If you break your leg and then the bone healing becomes normal and you are good to go. If you break your arms and they are treated and the healing time is gone and they are okay, they have healed. We always do doctor's assessment. If you don't have any physical problem that can lead you not to move according to the nature of your work, and then we allow you to continue to work. But if you see that maybe there was a problem and it has brought some inability to do the work according to the nature of your work. Your doctor will recommend for you to get an early retirement or be shifted. I know the pain and I have felt it. So, or you are told to be shifted to another department that will not give you more problems than the field work. So, David Njoroge, I may request you to get a physical assessment from your doctor, and I know of your work will be taken to the government doctors from the Department of Forces, and then you will be assessed and they will tell you if you can be shifted to another department or if you can be given an early retirement. I think that is how it works. Assessment is very important because according to your question, you have said a lot injuries. I have broken both my arms and legs, but I'm very hyper by nature. Yes. Now that one gives you a one-to-one leeway to be talking to a doctor as this doctor advises you on the move, and there is a form that the doctor will fill. Hope you understand that, David. David Njoroge, have you subscribed to the channel? Okay, have you subscribed to the channel, David? David, I said that was by the way, but I'm not at all. Okay. Early retirement does not mean you are old. It means that you are getting retirement under medical terms. You can retire at an age, age of retirement has come, or you can retire under medical advice from the doctor assessment. So if you are watching, you are new, welcome to the channel. Big up David Njoroge, FRC, the Coffee Cakes, Sha Travels, where she is. Yes, like disability, you know, you can get injured at work, Coffee Cakes, and then it demands you to get an early retirement because you cannot continue it. By the way, this is the that time asking how do I know your channel? Yes, David, I meet so many people. I saw you once a week ago or two, I remember. So thanks a lot for being here, and everyone, Sha Travels, FRC, Coffee Cakes, and everyone that is watching. And if you are here and you have a question, it is important we interact. Let's interact. Let's ask questions like David Njoroge, who is from Lodwar. Thanks for asking those questions. Maybe they will help someone that is not here now. Welcome everyone. Now let's see, David, I hope your injury is healed properly. Fanya kazi yako saa. Yes, David. That is my work. Keeping people healthy and advising people on how to live well. You see, that is my work. Now, effects of thyroid distraction. When thyroid is distracted, you know, your thyroid helps to regulate heart rate. Fatigue, when you are regulating heart rate, the fatigue will not be there. Cold intolerance. So these are the things that if your thyroid is destroyed, you'll get fatigue, weight gain, cold intolerance, dry skin, constipation, and slow heart rate. You get, and that is where you get thyroid stimulating hormone and T4 blood test. When I started, we talked about how the kidney works. And the kidney can give you several issues. Kidney issues is not just one. The kidney. If you are injured the kidney, you will not just get one problem. Yes, ziko sawa, all the mental in the body and serial number. Okay, that is fine, David Njoroge, that is fine. So I'm good. Welcome. For your test, you are good. We thank God you are good. And we love when people are healthy. So we have here let's talk about the kidney. Common causes of kidney destruction, things that can make your kidney be destroyed. If you are watching my and you have not liked, please double tap your screen and subscribe. I see many people coming in and going, and so common causes of the kidney issues. I just talked about diabetes. Diabetes, high blood sugar damages your kidneys. High blood sugar. That's why you always see people that are diabetic, mostly they have kidney injuries. When you have high blood sugars, you will have something that is called diabetic nephropathy. When sugars go to interrupt the pores that are taking in what? That are filtering blood. And yes, I'm a boxer, and I was young fighting, we targeted the kidney or the lungs. It's called David. I like how you talk. Welcome. Now the kidney, as this kidney is filtering blood, and your sugar levels are high, you will have something that is called nephropathy. High sugars that are blocking the pores that are filtering. Just like the sieve that we use in the kitchen. If you use more things that can sediment, it will block the pores. So we call it nephropathy, diabetic nephropathy. And then you start having problems with hypertension, because if you have a nephropathy, because the kidney is not filtering well, that's happened during my opponent. Now, when you're not, the kidney will feel injured, and that is when it releases a hormone called renin. Renin tells angiotensinogen, hey, wake up in the blood. Please, there is a problem. Blessings, my brother. Thumbs up and done. Thank Barry walking exercise. Thanks a lot for being here. We are talking about random issues and how problems are connected to others. So angiotensinogen waking up, it converts angiotensinogen to angiotensinogen 1. Where in your blood we have an enzyme called angiotensinogen converting enzyme, which converts angiotensinogen 1 to 2, and that one is a vasoconstrictor. That vasoconstrictor makes your blood vessels to constrict and your pressure goes up. And remember, when renin comes out, it tells the something that is called aldosterone. Please retain more salt. The salt gets into your vessel. It brings more liquids in your vessel. See, that is how your pressures go up. High pressures can be a first step for heart failure. You see how things are connected? Right from, let me say, diabetes, and you don't want to take medicine as per the doctor's advice. You don't want to inject yourself. People with diabetes type 1, they use insulin. People with diabetes type 2, they use drugs like metformin, which stimulates breakdown of sugars and insulin to come out more. Those are how things are connected to the kidney. You see, high blood pressure, long time hypertension scars, because when pressure is so high, the filtering changes. It starts to form scars, and you've seen with kidney injury you have high blood pressure. Guys, I know when people are so quiet, they are listening quietly and trying to synthesize. So if you are watching and you have not subscribed, my friends, subscribe. Ask me any question. Let's interact. Let's talk about health. Let's talk about the health of our bodies. Infections. Yes, infections are very common. You can cut yourself, you get an infection. You can get a flu, you get blood infection. You can be promiscuous, you get infections. For people that are promiscuous, you get the syphilis, you get gonorrhea, you get urinary tract infection. And you know, when you get urinary tract infection because of being promiscuous or not taking your sanitation properly, it goes up to the it goes to the blood. Doctor, I got HBP, high BP. They put me on meds, but it was from pain. However, I still take. They still want me to take. Do you still have pain? The coffee cakes. You know, your doctor will look about the pain and some other issues, yeah? And it is very important. Do you still have pain? Yes, if you stop, you can have chronic high. If you stop the medication, you can have high blood pressure that can be so low, high, and then it will hurt your kidneys. And then when you hurt your nephrons because of high blood pressure, you will start to be taken to dialysis. So it's better to adhere to them or get a drug that can make your pain to subside. I gave you some medication on your WhatsApp. Hope if you can find them, that will be better. But at times, if you can find a way to relieve the pain, it is better than taking the medication for high blood pressure. Chronic, you get. So adhere to the doctor's advice. So I was talking about infections. So infections, you've got a urinary tract infection. You like hitting here and there, or your sanitation is poor for the women. Yeah, hitting here and there is not good, because if you get syphilis or gonorrhea, it will go up to your blood. When it is in the blood, we call it cystitis, because it is eating your blood vessel, your bladder lining. And then when you have not treated it well, it goes to the vessels and it goes to your kidney. So those infections starts to eat your kidneys, and you have to do dialysis, because now the kidney is failed. You didn't get treatment at the required time, or you didn't get the required treatment. You get, my guy, how things are connected. So you started having bad sanitation and it ended up you getting dialysis. Yes, and you are now taking antihypertensives, because any patient that has a kidney problem, most of them have hypertension. Just how I've told you, they are connected. Let's talk of autoimmune diseases like lupus. Lupus, I keep taking my pills. Yes, please keep taking your pills. It's very important, the coffee cakes. You see, let's talk about lupus. Lupus nephritis is inflammation of the kidney caused by lupus erythematosus. It's an autoimmune disorder. Those people have a problem, because autoimmune disorders, you cannot help them. They keep on damaging your blood vessels. And then obstruction, kidney stones, enlarged prostate, or tumor blocking in the urine. Prostate, we talked about the prostate, how it blocks the urine from flowing from there. And then we talked about the kidney stones. We talked about the kidney stones. You see, the kidney stones themselves, they can obstruct urine from flowing. And then it becomes post-kidney injury, just like the prostate, because urine now starts to backflow up to the kidneys. And then what do you have? A problem. My guys, you see that? That is very funny, but it's not funny because it can damage your life big time. Reduced oxygen, severe shock, dehydration, blood loss to kidney injury can hurt the kidney itself. Drug toxins like painkillers, drug and toxins Painkillers like NSAIDs, non-steroidal anti-inflammatory diseases, drugs like aceclofenac, diclofenac, brufen, they can harm your kidney, and certain antibiotics like ciprofloxacin that are metabolized both in the liver and the kidney. You see how I'm going slowly? We have polycystic kidney disease, genetic disorder that causes cysts. Doctor, have you ever had someone with 2 uterus? Yes. This one is a genetic disorder that comes with mutations. You see, very important. Let me ask the coffee cakes. Did you see? Yes, it is called duplex collecting system. Let me ask coffee cakes. Did you see that? Have you ever seen that person? These are things that are there, coffee cakes. Mutations that end up to have 2. See, so it is normal, and sometimes we find that there are surgeries that are done, the ureters, and the thing can happen, or most of the things that happen, they start from conception. Some people are born with 2 ureters from the kidneys. It's called duplicate ureter or duplex collecting system. And if you do a CT scan, you find it is duplicate. But surgeries help sometimes to reconstruct and sometimes to help to not to have problems. Now we have talked about polycystic kidney disease that can destroy the sometimes it cannot be good, sometimes it can be good. You see, if there are no bad symptoms, there is no need to do a surgery, because sometimes people will live with it. But if it is bringing more bad symptoms, according to how the ureters are placed, blocking each other, or passing through a blood vessel or a nerve or something, that is where you do what? You stop. You say, no, let's divert, let's remove this one, which is normal. But some people have lived with it and they are good. If there is any infection, you take antibiotics and you live long. It's normal. So, but the kidney, we're talking about polycystic kidney disease, genetic disorder causing cysts and progressive destruction, forming cysts and progressive destruction. And in the kidney, if someone has kidney injury, you will see puffy face, legs of face, reduced urine output, fatigue, nauseated every time, nausea, you want to vomit every time, and high blood pressure. Kidney biopsy in some cases to find out, you should do kidney biopsy in some cases to find out if it is cancerous or there is something wrong going out. Kidney function is the first test that people do, kidney function. But the most important thing when it comes to kidneys, is control diabetes and hypertension. Antibiotics for infection, stop harmful drugs and alcohol, dialysis in severe failure, because if you don't do dialysis, you will have toxicity and you can die. But there are some things like for end stage people do kidney transplant. It helps for some time as you continue with life. You see, there are those people that have problems like most genetic problems. You check like there is this disease called the sickle cell. Sickle cell is a problem that the cell looks like a seashell and it's not big. It cannot carry enough oxygen because it's a genetic thing. It comes from the bone marrow as it is, whereby the protein that is supposed to be this side on the DNA has transchanged, so it's bringing something else that is not a cell. That one you can do nothing, because you only need to transfuse when it is bad and give fluids when someone has pain, vaso-occlusion. So those are the things that people do. And then there is something else like some things have people with sickle cell can't get malaria, because malaria is whereby you take the parasite goes to the cell, hides there, multiply, and what brings that parasite is malaria, mosquito. So if that is a sickle cell, it means that this person cannot get a malaria because the parasite cannot stay inside the cell. You see? Just like someone asked me last week, why can't some people some people don't get HIV. Some people don't get HIV. Why? Ask me that. And I told them because HIV is a virus. HIV cannot produce itself. The virus cannot produce itself. It needs another DNA to duplicate it so that it comes out with another virus. So how can this virus, this HIV, get another DNA? It is only through something that is called replication. And this replication happens like this. The cell, the HIV virus, have to get into the cell of a human being and go to the nucleus of the cell to copy the strand, to transcribe and translate it to another cell that is now HIV and to spread. But there are some people, these people are funny. They don't have something that can make the HIV cell to get into cell of a human body. They are called receptors. Like this, let me say this is my cell. So this is the receptor. It's like this. So when the HIV comes, it has to get here so that it can go inside. You check this. And there is that process of, after it has gone inside, there is that process of transcription. It is taking the script, translating it, and then it produces another strand that is like your cell. Yes, Miriam, hi. That is like the other cell. So they become so many in that nucleus and they burst. And that is why now it produces more HIV cells in your body. Bosswan, welcome. Today I'm just talking about random talks. So I asked this person, now if this HIV cell has nowhere to attach itself so that it can go to the inside of the cell. How will you know? Will this HIV get to the cell so that it can multiply to bring more HIV cells? There is no way. But you know your body has some white blood cells, the lymphocytes. T lymphocytes and B lymphocytes, and then you have another one which is called natural killer cells. They are always around your body, walking, finding strangers. So when this cell gets and it's not getting anywhere to go inside your cell so that it can copy your DNA to create more, and it is still hanging in your body, the natural killer cells comes and takes it and destroys it from your body. The macrophages comes and takes it. It detoxifies the toxin and then it removed from your body, you know. And this is how some people cannot get the HIV. You see, this is how some people cannot get the HIV. So if you are now you are surprised. There are some people that don't have receptors on their cells and they cannot get HIV. You see, very funny. Humble Marcia, welcome Humble Marcia. Greetings Dr. Ben and everyone in the house. We are just having a random talk. If you have a question, please be open to ask anything. So this is how some people are confused, and there is no one that is called a HIV carrier. You get? So doctor, only no receptors to HIV or all diseases. Oh, you see, how is it possible that some do not have receptors on the cell? Yes, there are some people now. HIV, very many drugs have very many diseases, even the viruses have the receptors that they need to get into the cell. HIV is not like a bacteria. It cannot produce by itself. It produces by transcribing your DNA, which is inside your cell, to multiply. Let me repeat this process. It's very good process. HIV attaches itself to I don't want people to interrupt. I want us to listen carefully and slowly. Your cell. Let me get a paper so that we learn slowly, so that you can know how some things happen. You see, your cell. Let's get to know. This is a cell. Let's use this as a cell. So these are the receptors on the cell wall of your. You see, now these receptors is called. There are several. One is called GP120. Another one is CCR5, CX, CR4, and CD4. So these are the receptors: GP120, CCR5, CCR4, and CD4 count. That's why we do the CD4 count. So when a cell comes, the HIV cell comes. This one is HIV cell. This is an HIV cell that has come. It will come attach itself here. And it will get to the cell, to the nucleus where the DNA is. So there are some people who don't have these receptors in the cell, this GP120, CD4, they are born with that thing. So this HIV cannot get into this cell because it needs to get into this cell to copy genetic material to produce more virus, and then this cell will burst. When this cell bursts, it produces more cells, HIV cells, that are going to copy the others in the body. So after that, the viral envelope fused with the cell membrane and HIV enters. You see, when this virus gets, let me put it in red. Yes, Stan's Kitchen, we are having random talks. Yes, it fuses. So I'm saying some people don't have these receptors. That's why you keep on seeing when people are going to, we keep on asking about the CD4 count. So it gets inside to go to copy. You see? So HIV, HIV contains RNA, not a DNA. It is called, DNA is deoxyribonucleic acid. RNA is ribonucleic acid. Its work is to copy and translate. Is to copy. It copies the strand. So the enzyme reverse transcriptase converts RNA into DNA. And then it is integrated to your cell. Yes, like COVID. It is integrated to your cell. It is called integration now, integrated. Because the RNA of the virus, it has entered, it has integrated. You see? Then it transcribes like guanine, adenine, thymine, cytosine. Then it copies this strand of your DNA. After it has copied, it is called, that process is called transcription and translation. After it has copied, what happens? It produces, it assembles another small viral that now are a virus. Inside your cell, you get some more virus that have been translated from your body. That have been copied and produced. It has copied your strand of your nucleus. Over time, HIV destroys CD4 cells, weakening the immune system. You see? And this is how your HIV is multiplied. But if you don't have this CCR4, CXCR4 and CCR4 and CD4 receptors, what will happen? The virus will not go in inside yourself to multiply. And this is how the drugs for HIV are working. They inhibit. We will talk about how these drugs are working, the antiretrovirals. They stop this. They stop these processes. If it is copying, or when the HIV is copying your RNA, there is a drug, HIV drug, that stops the reverse transcription. So we call it reverse transcriptor inhibitor. So if it is integrated in your system, doctor, how do they know if you have the receptors or no? Plus, given blood. Now, can they get them? That is a very good question. How do they know that you have receptors? There are some tests that they are done, but there are so many. They are so expensive. Immunotyping. There are some tests that we do to analyze the cell. Some people inherit a mutation called CCR4, CCR5. Just like the other mutation, some people inherit. So you will find that you can take the blood to the laboratory and it is done some tests. And those tests will show that you don't have these receptors. Either you have them, but they are not working normally because they have mutated. You see, some people inherit the problem from their genetic, genetic mutations. So that is how you can know. But these tests are very expensive, so some people don't do them. And you have asked, can they then get them? Now, if you have a genetic problem of your cells you are born with something that is mutating, if you are living a normal life, there is no need of being worried. But if you have a problem, you must be worried. Like, let me say, people that have a sickle cell, you see, it is the pain and the symptoms of anemia that make them go back to hospital. But people that have these receptors that have mutated and they are not working normally, they are living normally. So you cannot have, if you have no problem, no need to worry. After all, it is protecting you from getting HIV. I got a problem that is helping me to get away from another problem. You see. So that is how some people don't get issues like HIV normally. So you make some people are married and they call themselves discordant, and this is the situation. One of the partners cannot get because of mutations of these problems. You see, one day we'll talk about how these drugs work to stop a person from getting HIV. But you see, the kind of HIV strains that come out after it has been transcribed is so high. That's why we always talk about the viral load. The viral load. So that is, by the way, about what is going on to some people's lives. And you see, they are connected things. Immunity cells, how to take care of yourself, very common, and it is important we take care of ourselves. It's very important we take care of ourselves. Today I have not been answering questions from the email because there are so many, but I will try and choose the best ones to answer. So this was just a short session to light up the evening. The weekend we did not connect. The weekend was so long, we did not connect well. And right now I may ask if you have a question and you are here. If you have a question and you are here, ask me anything before I log out. It's here. It is at 10:30 p.m. Here it is 10:30 p.m. It's at night. I understand some people right now it's morning hours. It's around 10 there. It's around 10. You see, where they are. It's around 10 when they are. Someone is asking me a question. Let me answer. Let me answer. If you have a question, just ask. 1:30 in the afternoon here. Yes, so that is it. If you feel you have a question, I know when I've said some people cannot get HIV, some people got confused and they were some people cannot get HIV. That can be so funny. So that is it, my friends. That is it, my friends. If you have a question, ask. If you have any question, ask. Random question, any medical question. Before I log out, it's important we get to understand. Get to understand some concepts of life and myths, because I've had so many people. I've had so many people telling me that they have some of the people are carriers. There are no carriers where HIV is. A carrier state is somewhere where something has gone to hypnotic stage. It is in still stage, but if it is given a chance or some things are exposed to, it can become alive. You see, so there is no carrier state in HIV, because that thing is live every time. If you don't take precaution, what will happen? You will have problems. You will have problems. You see, so anyone who has a question with him, because it was a session of 1 hour, and then we wrap up. We wait for tomorrow. Today people gave me some topics that they want me to talk about, so I will not go by my schedule. I will go by their schedule. So from tomorrow there are some 2 topics that we are talking about. Very important topics. Very important topics. So tomorrow, if you had a request at 4:30, that will be your time. You see? So I have how many minutes to go? 13 minutes to go. 13 minutes to go. Let's talk, my friends. Let's talk. Any question, any random question to clear those hours out, or anything that you can. Humble Marcia says, can it be passed on to someone else? Yes, if a mutation can be genetic. So if you have the mutation and it is genetic, you can pass it to your children. You can pass it to your children because it's genetic. Your children can be born with it, one of them or 2. Bomasia, that one can be passed to the children. Okay, we have David Joroge that is saying, what about a metal plate to the body? There are some things that we do, and we are exposed to. We get a fracture of the body, and then we get to be given something that is called ORIF. ORIF is called open reduction and immobilization. When you have a fracture, we open, we put screws and some iron plates. That is what my friend is asking. If you have metal plate in the body, or if it is not bringing any problem, you can stay with it for years, as much as it's giving you the function of that broken. But if you have healed and then it starts to give you some sepsis, it starts to give you problems, because it's a foreign body. A foreign body cannot stay in your body. You understand? It can bring issues. There are some that it doesn't bring issues, but there are some that it brings issues. It is good to remove it, not to stay with it for so long. So you will go to a hospital when you are healed and the bone is healed and it is compact. Then you remove it, because you don't want foreign things in your body that brings problems. Doctor, what you thought about a new virus called hantavirus? That one is a thing that is a virus is a virus. It will take its course, and some drugs are there to suppress it, and after some time, after 2 weeks, you are good. But if you succumb to the symptoms, you see, the symptoms, because it has no treatment, you can succumb to the symptoms. You can succumb to the symptoms. But a virus, when it is better suppressed, it dies after some time. Just like COVID. COVID came, people got it after 2 weeks in hospital, someone is out very okay and walking, because it's a virus. But if it goes so much and gives you problems like fibrosis, you can succumb to them. And that's why, how to COVID. Abinash Konjam. Abinash, welcome. I had not seen you. If the HIV viral load is under control, can it be passed to someone else? No, viral load, when it is down, it is safe. But it doesn't mean you, Ambulmasia, it is safe, but it doesn't mean you don't use protection or you don't be careful, because you never know. It can come alive. Viral load, when it is undetected, it means the virus, the drugs have worked and suppressed the virus. But if you don't take the drugs, it can come out again. One virus can go on and multiply to be many. Oh, it is carried by mice. I see. So Ambulmasia, chances of passing it are low, mostly sexually. But the thing is, you should protect yourself. Maybe if you are couples, that is when the problem is. But when you are not a couple, protect yourself. See. David Njoroge says, I can't find myself in that. You see, nijikute in Swahili means me find myself there. Never. Never. So that is how things work. Is there. You see, so that is it, my friend. That is it. And some things we are a matter of. David is saying, let me laugh. Yes, David, it's good for people to know. I've met couples at my work station that one of them is negative, the other one is positive. You have to tell these people the truth and advise them accordingly. You don't have shame because they are there looking at you and you are there to advise them. You advise them the truth. Hantavirus. This thing is giving people a lot of problems. And Abina is afraid of hantavirus. Abina, why are you so afraid? Are there people around you that are having hantavirus? Zoonotic. They are called zoonotic disease. Right? And I'm finished with that part of the world. Yes, Humble, you have finished, but it's got to ask questions so that the other generation can be sensitized. You see, hantavirus is given by a vector. When you go to your staples, when you go to where your cows stay, and your stores, and your rodents are there, the mice and the mice are there and they have the virus. So when you inhale, you get it. Hantavirus. Symptoms are like fever, muscle aches, headache, fatigue, difficulty in breathing. Then you start having hemorrhagic fever or renal syndromes on your kidney. So we do blood tests and kidney functions, but after some time, when it is contained, you go back home well, and you see. So my friends, but Doc, David is telling me to say the truth. Which truth, David? I'm telling people the truth. Be careful with someone. Don't let no one tell you that my viral load is low, so we have no problem, we can just engage. No. Tell the people the truth, just like you are saying. It's important to tell people the truth about it. So my guys, that is it. I don't know if there is any other question. I only pray that you continue sharing my channel so that we grow and reach more people, the people that need some advice. I think they don't want to scare us about the antivirus. It's not just they don't want to scare you about antivirus. It is just like how COVID came. If it is bad, it will be bad, and you will see the effects. In MV hand use ship, where 3 people already die and my aunt all get sick with few days. Yes, because it's a flu. You have ever seen, if you are going to school or at workplace and you are in an open office, if someone gets a flu, all of you in 2 weeks will start coughing, or a week you'll start having puffy noses, you get. So it is like that because you contact it by inhaling it, and the virus works on the respiratory surfaces, the kidney. Next time, say a lot about how painful it is. Yes, it's painful, and we take care. Let's work with them. So it's like COVID. Hunter is another thing, COVID is another thing. COVID is just like SARS. So it mutated to COVID. COVID is just SARS virus, and it graduated to COVID. So if you want to protect yourself from hantavirus, when you are in public, put on a mask, wash your hands, the best protection, because hantavirus comes by inhaling the virus. You are talking closer to a person who has it, and you are inhaling the person's breath. You get it? So put on masks and wash your hands with soap. Wash your hands with soap to avoid problems. Simple rules. Yes, I start wearing my mask. Very important. Because if you put on your mask, the droppings and the inhalations will not cross that mask. And after you have used it for a whole day, put it on soap and water, or throw it away where it is safe, or burn it. Get another one tomorrow. If you don't have that, there are some people who don't have the finances to buy a mask daily. So what you can do is, after you have used it in the evening, in soap and water, wash it with soap and water. Soap and water kills the virus walls. So my guys, thank you for being with me this evening, for the little advices, and always being here. Those advices are Betty high. Those advices are life-saving. I don't need to wear a mask. I don't step out of my house. Okay. Betty, welcome. Thanks for being here. Yes. So tomorrow we will talk about the topics that you have given me today at 4. My guys, be blessed. Be blessed so much for your support. Be blessed so much for your support, because if this channel grows, you who is watching will see how it will help some people physically. How it will help some people physically. That is my prayer. And you know, when I mean helping some people physically, is that the plan of a big hospital referral system will come up, you see. And I really need a hospital that has all the equipment, including an MRI machine. An MRI machine. Some people go to hospitals and bless you, doctor, for sharing. Most doctors here do not explain. You wait for 45 minutes to see doctor for 5 minutes. Yeah, the coffee cakes. That is normal when people are under pressure. So I was saying that a hospital is the diagnostic tools, not even the drugs. And to buy the diagnostic tools is the most important, expensive thing. If a person needs to be saved in time, you need the right diagnosis. And imagine a person has come to hospital, you need an MRI machine, and you need to send this person miles away so that you can get the results, maybe even after 1 day. So my prayer is I have all those. Joroge, even some level 5 hospitals don't have those machines here in Kenya. They don't have good laboratories. You have to go to level 6 or private hospitals that are invested and really equipped. And you know, private hospitals, how expensive they are. So thank you for sharing my my platform. Thank you for being here. Let's meet tomorrow. Joroge, share this channel, Joroge, to your colleagues, your friends. You see, forgiveness is underrated. How my friend in Kenya doing? I'm fine. I'm just about to finish forgiveness and I know you have a question. Forgiveness is underrated. Never loses a question. Forgiveness. Ask me anything as I'm going out. Ask me anything. Today I'm not in a hurry going out. We were talking about random medical issues, forgiveness, and asking people to share my channel so that people come in. Will be a big platform where we share everything. Hemorrhoids. Hemorrhoids are distended anal veins, and they come because of some things. Most genetics can cause hemorrhoids. Genetics can cause hemorrhoids, and we have high blood pressure. Constipation can cause hemorrhoids. Constipation. You see. So if you already have them, you should be using laxatives. I hope you are on laxatives so that you don't continue pressuring them. And some drugs, sometimes we call them pies. Some drugs that helps to constrict the veins. For you not to feel down there that you are scratching yourself so much, use some antihistamine creams like hydrocortisone, local anesthesia creams, because now when they come out with nerves that are exposed and you feel pain. There are some procedures that are done when they are so much, but there are those stool softeners and those drugs that you apply down there so that you cannot. But the bad thing comes when they are bleeding. Forgiveness, are they bleeding? So forgiveness, make sure you are not getting constipation because you already have them. To reduce the pain, take more fibers and laxatives. Now you have them. Straining bowel movement, low fiber, obesity, long sitting periods, colic, diarrhea, and heavy lifting. So, okay. So I think I will talk about it tomorrow. That time that I'm always coming online, I will talk about the same habits. Because this week you are the ones who are giving me topics to run. I'm not giving any other topic. You told me to talk about those topics and I will talk about them. So friends, yes, it is 16:30 Kenyan time. PM, 16 PM, 16:30 PM Kenyan time. So my friends, thank you for tuning in and thank you for relating to me. Let's grow slowly by slowly, patiently waiting for any food may help like ugali. I don't care. I learned, doctor, trust me. I'm a good cook. Welcome. Tomorrow I'll be doing that. So forgiveness, I will start with your topic, then I'll go to multiple melanoma and then liver cancer. And then the next day we'll take the next. So I will start with hemorrhoids and then multiple melanoma. Because you have really insisted on that. So guys, let me head home. All of you be blessed. All of you be blessed. Let's meet tomorrow. The coffee cakes, please, okay, tomorrow at 16:30. Hope you will be having some time. 16:30 Kenyan time. Kenyan time. Bye bye. See you guys. Bye. See you.